Hydrocoele in under 5 minutes. A short tutorial for Discover Pediatric Surgery by Andrew Grieve, Karen Milford, and Nirav Patel. Hydrocoele in children can be congenital or acquired. Congenital hydrocoele is primarily found in male children, but can occur in females. In order to understand what a congenital hydrocoele is, some understanding of embryology is necessary. During intrauterine life, the gonads in both males and females descend from their retroperitoneal origin at the urogenital ridge. In males, this descent carries the gonad through the inguinal canal into the scrotum. During this process, a diverticulum of peritoneum is carried with the gonad. This diverticulum is known as the processus vaginalis. In females, although the gonadal descent terminates in the pelvis, the ovary is anchored to the labia by the round ligament. The round ligament passes through the inguinal canal to form this point of fixation, and it too is covered in a diverticulum of peritoneum. By term, the processus vaginalis should close, but it can remain open and either remain asymptomatic, present as a communicating or encysted hydrocoele in a male, present as a cyst of the canal of Nack in a female, or present as an inguinal hernia. Actually, a congenital hydrocoele occurs when a patent processus vaginalis contains peritoneal fluid, whilst the hernia occurs when the patent processus vaginalis contains intestine or other abdominal organs. The diagnosis of hydrocoele is clinical and based on history and specific examination findings. Patients may present with a history of a swollen hemiscrotum, with the swelling appearing worse at the end of the day. Children with suspected hydrocoele are examined in the supine position, with the affected hemiscrotum first being inspected and then palpated. Patients with congenital hydrocoele must be distinguished from those with hernias, as their management is quite different. On inspection, a swollen hemiscrotum with no obvious discoloration, erythema, or edema may be noted. On palpation, no underlying bowel is felt, and it is often possible to feel the testicle on the affected side. The testicle should feel normal. Additionally, it is possible to palpate above the swelling. This is in contrast to an inguinal hernia, which may appear and disappear, which can be associated with a thickened cord on the affected side, and above which you cannot palpate. Management of congenital hydrocoele in children under the age of 2 is expectant, as many will resolve spontaneously. In children over the age of 2, children with a large, tense, painful hydrocoele, or in those in whom a swollen hemiscrotum is causing psychological distress, surgery is indicated. Surgical treatment of a hydrocoele is a herniatomy on the affected side. The procedure carries low risk of complication, with the common concerns being pain, scarring, bleeding, wound infection, and in male patients, potential injury to the vas, testicular vessels, or the testes. Surgery is usually performed by means of a small incision in the groin, and patients usually return to normal activity within 3 to 4 days. If parents notice any danger signs, including fever or vomiting, severe tummy pain, excessive redness, discharge or bleeding from the wound, or excessive groin swelling, they should return for review immediately. In those children with no danger signs, dressings may be removed after 4 days, and the child can bath normally. Follow-up may be performed telephonically for most uncomplicated cases. Acquired hydrocoeles are usually the result of testicular inflammation due to trauma, infection, or an underlying tumor. Acquired hydrocoeles due to trauma or infection usually resolve spontaneously and do not require surgical intervention. In young children who present with spontaneous onset of a hydrocoele and in whom the testicle on the affected side cannot be palpated, ultrasound investigation of the testes is warranted. This is so as a large, tense hydrocoele may point towards an underlying testicular malignancy, and herniatomy in these patients is not indicated. Thanks for listening, and please visit the Surgeons for Little Lives website or the Discover Pediatric Surgery podcast to download and share this and similar tutorials for free.